Hi, cool. Hi everyone. Welcome to Vital's very first digital health speaker event of the semester. For those of you who are new to Vital, welcome. For those of you who are new to Vital, welcome. We're Northeastern's healthcare innovation core. We aim to empower our students who are interested in the intersection of healthcare, technology, and entrepreneurship by hosting events like this and co-op panels and many other fun opportunities. So we started our digital health speaker series in the fall of 2020. Some of the topics that we looked at are wearable technology, mental health, and data in healthcare. If you're interested in any of those topics, we encourage you to watch the event recording on our YouTube channel, or you can read up about the key points on our Medium. So to give you guys a little peek into our upcoming events, we'll be featuring some digital health companies who are specialized in tackling health issues for various age groups, for example, pediatric or geriatric. And then after that, we'll be diving into the intersection of fintech and healthcare. And today we are very excited to be collaborating with Pair Health Exchange. So now I'll hand it over to Nikita to say a few words about their organization.
Awesome, thank you. So Pure Health Exchange is a national nonprofit organization which is focused on empowering young people and teens with the knowledge, skills, and resources to make healthy decisions. So in order to do this, the club trains college students to teach a skills-based health curriculum that focuses on inclusivity and engaging in real, honest conversations about health. So our Northeastern branch has over 150 members, and we meet weekly to discuss topics related to health equity, busing, redlining, and a lot of health resources to be equipped with the right skills and knowledge, so that when we go into classrooms, we're prepared. So if you're interested in finding out more about Pure Health Exchange, this is just like a little plug. You can follow us on Instagram or check out our website.
All right, thank you, Nikita. So today's topic is health tech literacy. So many of you guys may heard of health literacy, which measures how much we know about healthcare in general. Oftentimes, someone's health literacy is predictive of their health outcome. But for digital health, which is kind of a really fast growing and overwhelming realm, how much do we really need to know about it? And why is it important that we need to pay attention to some of the really big areas, such as telemedicine? So today we are very fortunate to have two industry leaders and healthcare educators who are here to share their insights regarding the topic. So starting with Ms. Dawson, could you please tell us a little bit about your background and your journey in the healthcare realm?
Sure. Hi, everyone. I'm Jamie Dawson. So, oh goodness, I guess I can go back to undergrad. I went to Michigan State University, Lyman Briggs College, and studied human biology and also did a focus on bioethics and humanities. I thought I was going to go the med school route after college, but life happened and I went on a different path. I ended up moving to Washington, D.C., and took a job at the National Association of School Nurses. It was pretty random. Just found a job because I needed one and started working there. And it was a great experience. I did grant work and development work, and it was a focus on school health. So I really enjoyed, working for the pediatric population and helping to support nurses. And then I took a job from there at the American Nurses Association. And by that time, I had started going to George Washington University. I did my master's in public health, focused on environmental and occupational health. And so I was hired at the ANA to help run their Center for Environmental and Occupational Health. So I was doing that work for a while, and then I got really interested in the well-being space, especially because there's a lot of challenges.
Oh, I think you might have just muted yourself.
You heard me say all the other things, right?
It kind of cut off a little bit, but you're good. Yeah.
Oh, good. So what did you last hear? I said, I was at ANA doing work in environmental and occupational health, and then had more of an interest in well-being, because there's a lot of challenges with health and well-being for pretty much a lot of medical professionals. And so I worked on a lot of different topics for nurses, from from just nutrition to workplace safety, preventing musculoskeletal and back injuries, and just general well-being. And I helped start a program called Healthy Nurse, Healthy Nation, which still exists today, and really focused on helping nurses just get a little bit more support to be healthy at work and outside of work. And then I was just really interested in the campaign work and health communication. And just a little over a year ago, I took a job at Communicate Health. And Communicate Health is a woman-owned health communication and education firm. We work with plain language writers. Our team includes designers, usability specialists, and we really focus on the shared belief that everybody should have clear and simple health information. So I'm working on a couple of projects at Communicate Health. One with the Office of Disease Prevention and Health Promotion about physical activity. Really, we try to reach lots of different audiences, from pregnant and postpartum women to older adults, just trying to encourage people to meet the physical activity guidelines. And I also work on a project for the National Eye Institute, so really focused on helping promote eye health.
Awesome. Thank you so much. And Professor Intelli, please say a few words about yourself.
Sure. So I'm a faculty member at Northeastern. I have a joint appointment in computer science and then also in health sciences. I work in the middle of that space. And I guess sort of how did I get here? In college, I was in computer science and interested in actually robots in part was what got me really enthusiastic. And I took a course in my junior year. It was in robotics. And then from that, I ended up working in a research lab that was working on robots. And when I was doing that, I discovered that while it's interesting to make the robot kind of move around, I thought making the robot see was even more interesting, because the robot can't really do anything if it doesn't understand what's going on around it. So from there, I ended up going to graduate school working on in computer vision. That was at MIT. And when I was finishing from there, I worked on trying to get computers to see computer vision, and realized that, or got real interested in how you'd make spaces more interesting by using sensors like cameras. And there was this little project called the Home of the Future project. And I thought, oh, I'll do that for a year or two and then figure out what I'm going to do next. And as often happens, like it didn't, I ended up actually staying on it because it was kind of getting increasingly interesting, and ultimately ended up building up a research group there. And my research shifted from computer vision to trying to figure out how to create homes and environments that would help people age in place. And so effectively, my research shifted towards health and wearable technologies. And that's what I do now. I came to Northeastern to help start a PhD program in personal health informatics, which is patient-facing or person-facing sorts of health systems. And at Northeastern, I teach classes ranging from human-computer interaction and sort of data science for health to classes in personal health informatics and measuring behavior. What my research group does now is we try to figure out how do we get computers like your mobile phone, smartwatch to really have a detailed understanding of what you're up to. So physical activity, sedentary behavior, sleep, but also things like your habits. And if we can get the computer to understand those things, then on the health side, we're interested in how you would create new interventions that would respond in a more natural way to what people are doing. So think of it as kind of a just-in-time intervention that the computer might deliver to help somebody make behavior changes and to sustain those behavior changes over time. So that's a little bit about what I do and how I got here.
That's so interesting. All right, so since you were talking about your research, digital health and technologies, now let's dive right into our next section, which is our guided question sections. Nikita and Mega, please take the stage.
Yeah, definitely. So yeah, you guys have such really unique and different backgrounds. So I'm curious, how do you personally define health tech literacy? And how do you think are ways to measure it in the community?
Well, I could start, I guess. I don't have a definition of that per se. I think it's going to become increasingly important over time, and I don't think we're at a point where most people have that much health tech literacy, I guess. And there's a very interesting example which is occurring right now, which shows the problem, which is people trying to get vaccinated in Massachusetts. So if you go to the website that the state says you should go to, my family's been doing this over the last couple days because my parents are over 75, so they're now eligible to get a vaccine, and we've been trying to figure out how do we get them in to an appointment. And there are a number of problems, right? So my parents are they can navigate the web and do that sort of stuff, but they're not super tech literate. And that they can easily sort of get lost and frustrated. So that's sort of issue number one, right? Is we want to make sure people are well enough educated and comfortable enough to be able to deal with the technology they have to. But issue number two is that the whole website and the whole process is completely messed up. So um, to the point where I was talking about it today in my human computer interaction class, and we were using it as an example, it's really poorly set up interface that needs to be navigated in order to do this incredibly important thing. So here's a case where we knew a long time ago that this was going to happen. We knew, right, this was predictable, that there was going to be a time when people were going to have to go use technology to sign up to get vaccines. And I think that at least at this particular moment in time, you can say the technology and the literacy that people need to deal with what is kind of crummy technology, actually crummily designed technology, is not there. And as a result of that, it's exacerbating the health inequities that we already know exist, right? So everybody said for a long time, well, the vaccine distribution, it could make health inequities worse. And I think that's exactly what you see right now, because people who are well educated, or people like my parents who have kids who are well educated and understand technology, are in there trying to figure out how to make it all work for them to get them set up. And people who aren't fortunate enough to have that are going to get left behind, right? Um, so I can't quite, I don't know how to define it, but I know it's a big deal. And as our healthcare becomes more dependent upon technologies, particularly to support wellness, not just sick care, it will be very important that we try to figure out how to make sure that people are health tech literate.
That website example is such an important example, and I think there's so much there. I feel like we could talk about that for hours, but like the fact that it's every state is doing their own thing, and even sometimes at the local level, some websites are coming up for specific counties, and so there's not like any centralized sort of focus on how to roll out these vaccines, and it's been super challenging on top of a ton of already, really a difficult time in public health. So I think that's a great example. I can share some definitions. So we use for health literacy the simple definition that it's just a person's ability to understand and use health information. And I was kind of poking around like, okay, well, what is health tech literacy? And so, health information technology makes health information available to people through those digital tools like patient portals, wearable technology, mobile apps. And so health tech literacy, I think it's an intersection of those two things, right? Someone's ability to use technology to understand and really use health information to be healthier. And I think the other question was about measurement. I know that there's not just only one, accepted health literacy measurement. I know that there's hundreds. And so I think it really just depends on, what you're trying to assess. There is something called the Health Literacy Toolshed, which is an online database that has hundreds of validated health literacy measures. And you can really filter by different topics and domains to kind of figure out like really what you want to measure. There's even one in there about, somebody's ability to seek information through interactive media navigation. So that was the closest, there's a few that are a little bit more specific to health tech literacy.
Great, thank you guys so much. And that COVID example is so prevalent. Like I just remember watching the news yesterday, and that was like all they talked about really, like lack of access and lack of knowledge of how to like use the database. So prevalent. Mega, do you want to take the next question?
Yeah, sure. So I think you both talked kind of about health inequity. So on that note, what do you think the impact of health disparities are on health tech literacy, and how can we address this issue?
I can start with that one. So, people who are at risk for limited health literacy, are also at risk for having challenges with health tech literacy. And so, I think going back to that website example, this is really why it's so important that digital tools are designed to be inclusive. I think, backing up a little bit with health literacy, one thing we like to say is that health literacy is a state, not a trait. So anyone can struggle with health literacy and health tech literacy, especially in times of stress and fear. And again, COVID's the perfect example. It's really hard to have a clear head when you're trying to get information, to make an appointment about a vaccine, to get information about your health, to try to understand if you have symptoms and you need to be concerned about having COVID. And so again, this is really why it's so important for websites and any online tools to just be designed with plain language, to be designed. There's something called intuitive design that I can talk more about, but really making sure that these tools are designed for the people using them and are as simple and user friendly as possible, because people who are already struggling with health literacy are going to struggle even more in times of stress. And unfortunately, people who are who are dealing with impacts of health disparities are more likely to have those challenges if things aren't designed with them in mind.
Yeah, I think I would agree 100%. It's been, you're definitely going to see a very strong correlation in terms of people who have trouble just generally in terms of health literacy and the health tech literacy. I think the technology just, it should make it better, right? If the technology is really well designed, but I think unfortunately it often makes it worse. And our example over the last year is, it's a little depressing because it's one of these things where we know that we should be able to do better. We had a certain amount of time to plan, at least for this vaccine part, and yet we're not doing a very good job. So I think that's on a number of different communities sort of bear the the blame for that. But in the long run, we're going to have to figure out how to make it so that the technology really reduces the inequity, not increases the inequity. And some of that's about figuring out how to design the technology better. And then and a lot of that is about also education and things like that aren't directly health but have a huge impact on health.
Yeah, thank you. Those were really well thought out answers. I'm going to pass it back to Nikita.
Yeah, so you talked a lot about focusing on using health tech literacy to decrease health disparities. Do you think there's a way that health tech and like digital health and telehealth is hurting health tech literacy right now?
Well, I mean, the example we talked about is, right, you don't want people to be frustrated with technology because then it makes them feel like they don't want to deal with it, right? And if you take something like telemedicine, where the pandemic in some ways has been very beneficial because there's been years and years of talking about telemedicine, and the medical community and the insurers have essentially pushed back on it and slowed down the progress, right? And then suddenly this thing happened, and then telemedicine like became a possibility. So I mean, in my family, there have been telemedicine visits, and I mean, just things that didn't happen before. And there are definitely like telemedicine can help with inequities because it makes it so that people who are in areas where it's more difficult to get help can get higher quality help. So there's a lot of things about telemedicine that are positive. But if people also experience where situations where the technology has made things really frustrating, like the vaccine, then they're going to say, well, telemedicine, that sounds complicated, right? How's that going to work? And perhaps push back on that. I think for our medical system generally, I mean, one of the things that the faculty at Northeastern who work in personal health informatics believe is that in the long run, we're going to require technology to help us lower the cost of care because what we're doing right now is essentially not sustainable. So we have to use technology to help people, not just with sick care, but with wellness. And we don't want people to be shying away from that. But when they have bad experiences, whether it's with trying to find a vaccine or if they have bad telemedicine experience, then that's going to slow the process down. So I guess those of us who work in technology, we want to try to, as much as we can, make sure that when the experiences happen, they're good experiences. I have seen a few things where people seem to be suggesting, like, I think the general reaction to the telemedicine push has been reasonably positive so far, although the jury's still out on, how much does it impact quality of care and things like that. There'll be a lot of studies on all that sort of thing. But I've heard news reports, at least anecdotally, on NPR and stuff where they've talked about it, and it sounds like the consumer reaction to it has been somewhat positive on the whole.
Yeah, and I think it always goes back to like, how are things designed, right? Like, things need to be accessible. They need to be really easy to use. They need to be intuitive so that you're really understanding why you're designing what you're designing, who's going to be using it. And I think, when those things happen, then digital health can only help health tech literacy. But the opposite is true too, right? Like, if these tools are hard to use, if they're clunky, if they don't use plain language, it can be really difficult for people to use them. And I think, the telehealth is such a good example, especially, when we're thinking about, I'm sure all of us have probably had remote or virtual visits with healthcare providers, especially during COVID. And, I think that it's a great resource. Like, if you're in a location where you have good Wi-Fi, right? Like, if you can afford good Wi-Fi, if you are able to understand and read the portal, if it's in a language you understand, like, all of these things, it really does expand our ability to seek healthcare services. But it only works if the technology really does work for the end user. I do have something I could share, a health literacy checklist that I think could be interesting to just talk through. Let me see if I can do this. There we go. Here we go. I think this might share my whole desktop if I do this. Hold on, let me try one more thing. Here we go. Do you see that?
Yep, looks great.
Yeah, so this is online strategies for health literacy, and kind of backing up a little bit to the previous question, but it did make me think, especially as we're talking about, accessing care, telehealth. But just we don't have to go through all of this, but just like making sure, like, in a tool, that the content is actionable and clearly displayed. Plain language is super important here. Contrast, so when someone's even looking at a website, that it's easy to read, that it's accessible for people with disabilities, that the navigation is straightforward. So again, we don't have to go through all of this, but I think that, and this is something I'm happy to share, but that there definitely are best practices and things that we know really work and will resonate with people, especially as we're developing digital tools.
Great. Yeah, that's like actually super interesting. Sorry, Meg, I know it's your turn to ask a question, but I was just wondering, like, do you think that like lack of like clarity and accessibility to like clear health information could like impact distrust kind of in health tech literacy and like distrust of information? And have you seen that like kind of play out, or think of any examples of that?
I think that's a really good question. And I think that it goes back to really understanding who you're trying to help at the end of the day. One thing that we do as part of almost all of our projects is to do research with our end users. And so that might look like we have something called IDIs, which are in-depth interviews, or that might look like focus groups, things like that. And so what we want to understand, like if there are specific pain points, if there are reasons that populations might mistrust or, not believe certain types of health information, and really understanding, the needs of that target audience, because then as we're building solutions, we can be upfront and address any sort of barriers like trust, as we're designing our tools and websites. Does that answer your question?
Yeah, it does. It does. Thank you. Mega, do you want to take the next question?
Yeah, sure. So I think you kind of touched on this a little bit as far as like education and things like good Wi-Fi, but what are other barriers you think to accessing health tech literacy as a patient, a student, maybe a clinician?
Do you want to go, Jamie?
You can go. I feel like I did a lot of chatting, unless you want me to.
Well, I mean, I think those are the main ones. One of the things that we're trying to do is figure out how do we use consumer technologies how do we leverage consumer technologies for health? And there's always a danger there, right? Because the people who have the most resources have the most technology. If you think about smartwatches and stuff like that, my group does research with them. And our hope is that if we figure out ways to make things work, that eventually those things that the technology will become commonplace enough and inexpensive enough that it really does sort of just everybody's able to use it. But initially, especially if you're doing research in technology and you're trying to push the boundaries of what we can do, you're often starting off with people who have devices and technology that's more advanced. And so there's a balance there. But I'll tell you that when I first started doing some of this work, I would submit proposals to the National Institutes of Health, and sometimes you'd get reviews back, and we would say, we're going to do this, we want to run this experiment that's sort of testing out what you might do with smartphones. And this was when people really didn't have when smartphones were relatively new. And so people had flip phones, right, but not really smartphones. And so we'd get back reviews sometimes that said, well, this isn't practical because smartphones are too expensive, right? And so you do, at least for the type of work we do, we're always sort of looking at the future, right? And some of the things that are somewhat expensive today in the future, hopefully, are going to become more commonplace. And now there's still a small segment of the population that doesn't have access to smartphones, but it's diminishing further. And in fact, some people don't have computers who actually have smartphones, right? So you have to, at least in research, you sort of balancing out like what can we do today with what are we going to do in the future. But we definitely have to keep an eye out to make sure that we're not creating technology that can only be used by people who can essentially afford that. I mean, eventually you want these things to become something that's not that, and ultimately you'd say you want, well, I'm a proponent of more of a single payer sort of healthcare system, right? So you would want whatever technology is proven to be viable to be available to everybody as part of that. But sometimes when we're doing research, we're trying to use the newest stuff. And so it may seem like we're targeting people who don't have access to that, but it may just be that they don't have access to that yet. At least that's what we hope.
Yeah, and the smartphone thing is so interesting because it's like as much as 1 in 5 people only use smartphones to access the information, and we know that these days people are getting a lot of their health information online. And so one of the things that we really focus on when we're designing websites is making sure that everything is truly mobile friendly, because if it isn't, like it's very likely that people won't even be able to read it. We all know how hard it is to navigate a site that's not mobile friendly. So one thing that I could show, if it's helpful, is some of the work that we've done for people with low vision. Let me see. Can you see that? Yeah. So I mentioned intuitive design and that there's three principles of it. And one of the principles is just making sure information is accessible. So this is the project that I work mostly on right now, but we developed a website for the National Eye Institute to meet the needs of their users. And so we did a redesign to make sure that we, not only met, but really exceeded accessibility standards. So we built a site to accommodate assistive technologies like screen readers, because a lot of users of this website use screen readers. And some of the accessibility features we have here, like being able to zoom into 200% so that people with low vision can really access our content. And our sites are mobile friendly. We did testing on mobile with users with limited literacy skills. So again, like this is just an example of understanding, we're creating content for people who might have low vision and who might be accessing our website using assistive technologies like screen readers. And so we wanted to make sure we were thinking all of that through. And then let's see, what else did I put here? Yeah, so the other thing is the contrast, because some people can see contrast a lot better. And then if you want to hear more about intuitive design, the second principle is making sure things are empathetic. And we worked with the American Academy of Pediatricians to design a web tool about physical development delays. And so we did focus groups with parents to help them educate parents, and ultimately we want to educate parents and caregivers of young kids, so kids 5 and under, who have concerns about developmental delays. And so one thing I just really want to mention is empathy when developing things like this. Is even with COVID, with people who have low vision, like really understanding that people might be experiencing difficulties and stress in their life. And particularly in this example, it could be for parents who they're not sure if their baby's okay. And so, we wanted our content to never like imply blame or never add added stress, and to really truly be empathetic. And then this third one, just so you can see what this graphic is like, just super simple. And then this third one is really easy to use and understand for everybody. And so this is a Show Me app that we developed for the Massachusetts Department of Public Health. And it's an app that helps first responders communicate with people who have hearing impairments. They might have or limited English proficiency or cognitive delays. And the concept here is that it's like a simple, intuitive way for first responders to give information and gather it from disaster victims. And all of this is on the website, and you can read a little bit more, but you see like plain language, really simple icons that clearly kind of demonstrate, different scenarios and different situations that would hopefully help in an emergency. But so I wanted to share these examples because I think it does touch on, some examples of specific barriers and specific ways that you can address some of these health disparities as well.
Yeah, thank you so much for sharing that with us. I'm going to pass it back to Nikita now.
Yeah, so for that website that you created, is there like are the same features available in different languages like Spanish, Arabic, etc.?
That's a great question. So we've done at Communicate Health a lot of different content in different languages, and I think it goes back to who we are trying to create products for. That the website for the National Eye Institute is primarily English and Spanish right now, but certainly I think we'd be open to continuing to translate.
And kind of going off of that, like, do you think that there is like bias in health tech literacy, like research in this kind of field, where when you're coming up with strategies and coming up with and designing focus groups, do you think that there's some patients or some backgrounds that are overrepresented or underrepresented?
I mean, I think that's a super important question. I think that possibly could be a risk, right? And especially as if you have a team that might only speak one or two languages, right? We want to make sure that we're thinking broader, and that we are being as inclusive as possible as we're developing information. So I think that's honestly, it's something that we're all responsible for, really kind of taking a step back and making sure that we're serving as broad of an audience as possible.
Mega, I'm gonna turn it back to you for the next question.
Sounds good. So we kind of talked about the COVID vaccine, and in relation to COVID-19 and the COVID vaccines, how would you recommend distinguishing between real and fake scientific evidence?
Well, that's a really interesting question these days, given what's going on in our country. All right, and I mean, you see, this is why it's important for students to sort of have a general understanding of what's going on in AI and data science, because I think it's going to play a role both in helping people understand that, in terms of your question, sort of what's real and what's not real, right? But also it can play a role in creating misinformation too. So there's a lot of complexity to that, I think, at the moment. And I don't know what the answers are. I mean, I think for me, personally, I've been a little bit surprised and dismayed at what's gone on in terms of scientific literacy and the trust in the scientific process that we've seen in the United States. And I think a lot of researchers are increasingly concerned about it and trying to figure out what can we do about that. I think in another year or so, it'll be interesting to see, for example, what happens with the vaccines, right? Because there was an issue with trust in vaccines before all of this, and then now it's all intermixed with politics and other things. And it's really important for our society that people adopt the vaccines. We'll know, right? We'll if people are trusting in that or not. And so I don't know how to answer the question. It's a very difficult one right now. And I have to say, for me, as a researcher and somebody who works in science, it's so hard to identify with what is going on in some cases that it leaves me a little bit dumbfounded. But as a society, we have to figure something out.
Yeah, it's been a very unique time in history in that sense, right? Where like suddenly science doesn't seem to matter as much, in certain circles as it used to, and it does matter. And yeah, so I think COVID has definitely brought to light the dangers of misinformation. And I can definitely talk about some best practices to kind of teasing out like what could be misinformation. And it's and I think like everyone really does have a responsibility to share information in a way that doesn't spread disinformation. And so let me go through a couple of tips. Finding credible sources is an important one. That might be the Centers for Disease Control and Prevention. It might be a local health department. Checking to see that information is is based in science. And I think that's another thing, it seems like that would go without saying, but so much information has circulated where, we have no idea where it came from. And, being really thoughtful about what you actually share. And, there are some simple ways to tell if something, might not be untrustworthy. And again, it's kind of intuitive, but looking at it carefully, are there typos? Are there inconsistent formatting? Have you ever heard of this source? Is it just a random made up source? Who's sharing it? Why are they motivated to share it? And I think we all have to be super careful of social media, because information can come from anywhere and it can spread like it's truth. And somebody might say oh, my cousin is a doctor and he shared this with me, and it can make it sound like it's a credible source, but is your cousin a doctor? Who actually wrote this thing that you're sharing? And so, it's important to really take a close look at anything you see. before you share it. And then myths are a really super interesting thing in health communication because it can be really easy to call people out, especially on social media, for things that seem ridiculous about coronavirus. But when you repeat myths, you actually reinforce them. And it's really difficult to get people to change their mind, right? If they have a certain mindset, like repeating the myth and sharing a myth is unfortunately another way to spread disinformation. So really kind of focusing on sharing facts from reputable sources.
I'll say I have a ninth grader, and I've always been interested in at what point do they start teaching this sort of stuff with media? Because when I was her age, we didn't have so many sources of information. It was kind of like I had to walk to my library and look at the Encyclopedia Britannica, which is sort of basically dead. So now it's probably hard for most of you to even really appreciate this, but I mean, there was a time when you had a question, you couldn't immediately find the answer to it, and now we can, and you're used to that. But the danger, of course, is that not all the information is the right information, and so there's this new thing that has to be taught, which is how to do what Jamie's talking about, like how to assess the credibility of the source. And I guess the encouraging thing is they do talk about that in school. I see some of my daughter's teachers trying to get them to really understand how to do that, but I don't know to what extent that's really done nationally, and it may take quite a bit of effort, and maybe even more effort than what the teachers are putting in now to make sure that people really understand that. And it's not even just about it's the credibility of the source, but as Jamie's saying, when you combine it with social media, it becomes another beast. And that I don't think necessarily is being taught directly in school. At least I haven't seen that many examples of it. So it's an area that maybe we need to think a little bit more about.
I think that's such a good point. And I have kids too who like two kids in elementary school and one who's younger, but I have noticed that they are learning these things from a pretty young age. But I think like, once you're set in the world with social media, I think it's hard for adults to understand. So hopefully starting young will make a difference in how information is shared. Hopefully, I'm not too encouraged, especially recently.
Yeah, and that's again where the AI comes back in, because it's going to become increasingly challenging. You probably seen in the news these things where a neural network, artificial intelligence algorithm can like fake a video of somebody and it looks pretty real. So that type of thing, if you don't pay really close attention to it, and you don't have effectively like a gut check and say, well, would President Obama say that, right? Like, or something like that. If your instinct is not to pause and reflect upon what you're seeing, but rather your instinct is, oh, look at this, and you forward it off to somebody else, then we have a real problem. And so while on a website you can kind of look and say, well, grammatically are things right? Is the spacing off? Does it look like it's kind of not as credible as what you might get from the credible sites? These new technologies that can generate everything from text to video are really going to require keen observers to tease apart what's real and what's not real. If there's bad actors on the other side, trying to, and the fact that we have other countries and other things like that with incredible amount of resources putting this stuff into our society. As a society, we have to make sure that we're trained to be able to deal with it. It really is a pretty new world in that sense, I think.
It sure is. Yeah. And, and going back to the original question about the COVID vaccine too. I mean, I think I've actually taken a break from social media lately because I do get too worked up when I see when I see vaccine misinformation. And like you said, the vaccine misinformation was already a problem, and it's definitely a problem with COVID right now. I think there's a little bit less because, interestingly, I think with the vaccine being more in demand, or like not everyone can get it. I don't think there's as much widespread fear and disinformation about the vaccine. I think that more of that is coming
Yeah.
as it becomes more widely available and people really have to make the choice, do I get it, do I not get it? I mean, right now, people in certain groups are making that choice, but widespread, you know, there's not enough to go around. But I think, you know, like specific to the vaccine, I mean, I know that there's definitely a lot of myths circulating, but I do have a resource I could share if you guys are interested. We pulled together, we have a blog, actually you could just search for it. It's called We Heart Health Literacy. And we did pull together some we call it truth sandwiches, which is when you address false information, not by repeating the lie too much, but by starting with the truth, and then you kind of briefly acknowledge the lie, and then you end with the truth. And so something like mRNA vaccinations can't give you COVID. There's no virus in them, and the spike protein can't give you COVID-19 either. So it's like making sure that you acknowledge that there's this misinformation spreading, but you're not giving too much attention to that. So I can definitely share that resource if it's helpful, because you know, I think that there is a lot that we can do to make people feel comfortable with the vaccine, because it's going to be very important that this vaccine, you know, is adopted and people take it, because, you know, especially with these mutations in the virus coming, I mean, I think it's a tough time. And so now more than ever, we need to make sure that we're getting health information out there in a clear way.
Thank you both so much for answering our questions. We'd love to open it up to the audience now to ask any questions. You can feel free to unmute or talk in the chat. But yeah, go ahead.
I have a question. So first of all, really good talk. I really enjoyed everything that you guys had to say. I was wondering if you guys could speak to health literacy, not for individuals, but for like within corporations or within organizations, and trying to make different organizations more health literate. How do you deal with a group of individuals like that versus just with just one or two individuals and trying to change their behaviors?
I think that's an interesting question. I don't really, it's sort of out of my area, but the idea of having organizations involved maybe one path that should be tried a little bit more. There's a complexity when you're talking about health and businesses, and at least in the United States, because of the somewhat unfortunate tie between employers and healthcare, and it creates a strain. I think that's oftentimes like it means that employers, there has to be sort of a firewall between what an employer does and the individuals in those organizations that may restrict a little bit what's possible there. But I think that's a great question. I don't have anything in particular to say about, other than it sounds like a good approach to think about.
Yeah, and I'm curious if you could tell me a little bit more. Like, are you thinking about, is it the way that a company might communicate health information to employees? Is that sort of the idea?
Yeah, I think that with what I was trying to ask, it was kind of like it was very overarching. Yeah, you're right. I think I have to be a little bit more specific. I think what I was looking for is kind of how do you disseminate that information, or you get the leadership involved, and then how do you disseminate that information to your group so that you kind of have organizational change in that way, and what's the best way to do it? Because within companies, you're subject to a lot of different forces, and like groupthink becomes one really important factor there that you need to combat. And how do you change that within organizations or within corporations, or it's something like that?
Well, I love this question. I think that's so interesting. And it's making me think back to like places and points in my career when, important information, maybe it's something about how a health insurance policy is changing, right? Or, how coverage will change, or premiums might go up. And I think organizations have a responsibility to use some of these best practices to really kind of clearly communicate things to their employees and things to their teams, because again, this health is personal, and going back to that, that connection about your employer. I keep thinking about health insurance. I'm sure there's other examples, but making sure that that information is transparent and clearly communicated. Plain language is always important, you know, and no matter level of education, especially if you're communicating something that's complicated, like just really taking the time to roll out announcements and new initiatives really thoughtfully to your team. And again, going to your end user, like really thinking about the information that your team needs to know.
Mm-hmm. I don't want to take up too much more time because I think that, you know, other people have questions, but I would love to hear, do you think that there's specific resources that companies should invest in this point, like social workers to try and disseminate better information, or I don't know, through HR, better training? Is there probably isn't one path that will fit everything, but if there are just like a collection of tools that you might recommend?
Yeah, well, I think this is a really important question. And I think this is where, you know, diversity, equity, and inclusion comes in too. And I think sometimes companies need to recognize that internally you might not have all of the answers. And I think that's where consultants and outside help comes in, especially like, you know, if it's HR communicating like really important information about health or about benefits, just making sure that that you are getting some help and really thoughtfully communicating messages to your team. Does that answer your question?
Yeah, that was really good. Thank you so much.
Oh, you're welcome. It's a great question. Good to think about, you know, the organizations and system thinking. I love that.
Mm-hmm.
I also had a question. My question was more for you, Jamie. So I'm a first year biology student and I recently added a health science minor, so I'm kind of coming in with that perspective. We've been talking a lot about public health interventions and different methods of that sort just to in a lot of my classes. And so I'm wondering if you think there would be some sort of public health intervention to increase health literacy at a community level and like what that might look like.
That's a great question. So health literacy at a community level, are you thinking like who would be rolling that out?
That was my question, is like whether there would ever be something at this level, whether from physicians or from some other organization, like if that's even at all possible.
Yeah, well, I think that, you know, when it comes to health literacy, I think it's more about ideally it's being baked into everything that's being done, right? So if it's a public health department or if it's a physician sharing information, right? Like I in a perfect world, that those best practices that we talked about would be part of every message, really making sure that, you know, the information touched on those traits, you know, empathy and inclusive and gosh, I'm sorry. I totally blanked on the third one. Wait, I have it right here. But yeah, so anyway, making sure that things are designed to be, you know, created with that end user in mind. So I think that's the ideal world. I know it's not always easy, you know, especially if somebody's, you know, trying to get information out quickly. But it is important to think about that. And luckily, there's a lot out there already, right? Like there's a lot of resources that are already out there to kind of help thoughtfully communicate.
Thank you, Jamie. I also have a question for Professor Intelli. So could you tell us a little bit about some of the student resources or like the opportunities that our student could participate in, maybe like on campus or around Boston area that you're familiar with?
So sort of with respect to like digital health literacy in particular,
Yes.
is that what you're asking? Well,
Or just like technology, digital health development, innovation in general.
well, I think there's a lot going on at Northeastern that a lot of faculty who are interested in trying to understand how to create and use technologies both to enhance research, like some of the work that I do is on measurement of behavior to understand the relationship between behaviors and health outcomes. And then you also have faculty who are developing and testing interventions to try to understand how to help people stay healthy, how to help people recover more quickly if they've been in the hospital. So there's a lot of different types of work going on, styles of work going on. So I think the main advice I would give a student is sort of figure out the general area that you're interested in, and then look for faculty members who seem to work on something related, and don't be shy about reaching out to them. And even if you reach out to them and say, hey, I'm really interested in this topic, right? And the more kind of specific it's a little hard if you just say I'm interested in digital health literacy generally, but if you can maybe narrow it down a little bit, then if that faculty member doesn't do that, they'll probably point you to somebody else. And eventually, if you're persistent, I think you'll find people who work on at least related topics, right? Like Tim Bickmore, Professor Bickmore, he's in computer science, but he actually does all of his research on virtual agents for health and health literacy, not so much digital health or tech health literacy, but health literacy is one of the main things that they work on. But they do it all by creating these virtual agents. And one of the things that they found is that even though it's a pretty advanced technology in the sense that it's this character that you interact with and you have a dialogue with about various health conditions, uh, it actually is most well received by people who have low health literacy. And it's because it's a type of technology that you can, let's say somebody's in the hospital and they're going to get discharged. You would typically talk with a nurse and ask questions. Well, anybody who's been in that situation, you know that it's kind of intimidating, and they're always very busy. And sometimes if you want to go slowly, depending on that individual, it might not be that comfortable of a situation. Well, for some people, if you give them this virtual agent, they can kind of go at their own pace and they feel more comfortable. And he's done work that shows that he gets high receptivity to this type of technology in certain conditions. So it's a little counterintuitive because it's a pretty advanced technology, but yet the people who are actually like it the best have lowest health literacy. So there's that type of thing and a lot of other work going on. So I would say the biggest thing is be persistent. And if you email a faculty member and they don't mail you back, don't just give up. Like, try again and try other faculty members. And then when you do get in touch with them, what they would be looking for is you showing initiative. If you seem like you're going to go off and really push things forward independently, they'll get increasingly interested in what you're doing over time. But if you kind of go to them and you want them to tell you everything to do, they're going to be busy, and that's where it's a little harder to get started. So find what you like to do, find the people who like to do that, and then show some initiative and really push it forward. And suddenly you'll find that people become increasingly interested in what you're doing, and you'll learn more and more about new things.
All right, thank you so much for your advice. And I think we're about time, so I'm just gonna show a few slides and finish off tonight. So thank you so much for all of our speakers and moderators. We had such a great discussion about our regarding health tech literacy. And moving forward, we'll be having a recruitment workshop for Ventures Consulting, as they're currently recruiting new member for their summer project. And after that, we'll be having a co-op panel for anyone who's interested in healthcare consulting on February the 11th. And lastly, on February the 18th, we'll be having our HHIC workshop on the topic of patient-centered design. And thank you so much for everyone who's here tonight. To stay updated with Vital, you can follow us on our various social medias or email us at vitaldarknesseastern@gmail.com. Have a good night and stay warm in the snow.
Thank you.
Bye, everyone.
Bye.
Thank you.
Thank you.
Good night.